Hello and welcome. The following is a presentation offered by Consumers for Affordable Healthcare to help consumers use CoverME.gov's Plan Compare tool. Consumers for Affordable Healthcare is Maine's health insurance consumer assistance program. Consumers for Affordable Healthcare's mission is to help all Mainers enroll in, understand, and use their health coverage. The Plan Compare tool at CoverME.gov will allow you to estimate your financial assistance, know which plans will cover your doctors, hospitals, and prescriptions, what portion of your health care costs a carrier will pay, and allow you to filter and compare plans. To find the Plan Compare tool at CoverME.gov, you can click on Compare Plans under the Shop tab, or scroll down and click Compare Plans. Here you will enter the zip code where you live and then click Start Looking for Plans. Include all members of your household, including yourself and your spouse. There are some exceptions to listing a spouse here or on your applications. If you are a victim of domestic violence, you have been abandoned by your spouse, or you file as head of household. You can add a domestic partner if you claim them as a dependent or have a child together, and any claimed dependents, including students up to the age of 24. If anyone in your household already has coverage through an employer, Maine Care, Medicare, etc., be sure to check the box not seeking any coverage. Then, next steps. In this next step, you will enter your total projected household income for 2025. It is important to be as accurate as possible. If your estimate changes as the year goes on, you can update your income at any time. Your estimated financial assistance will include assessment for Marketplace and Maine Care for members of your household who appear eligible based on the information you provided. It is important to remember that eligibility assessments will only appear here for members of your household who are seeking coverage. A Maine Care eligibility assessment may be made for dependents under 21 and persons who are pregnant at the time of application if they need coverage and meet the income guidelines. On this page, you will also see estimated premiums, your tax credits, and cost-sharing reductions for individuals assessed as Marketplace eligible. Once you have reviewed this page, click Next Step. Enter all doctors and specialists you or other plan members will see. You will need to expand the search area if they are more than 25 miles from your zip code. Enter the hospital or hospitals you use most, and enter all medications and their dosage that you take regularly. This is an important part of determining if a plan will cover the care you will need. Then click Browse Marketplace Plans. While you wait for CoverMe to find plans, consider your medical coverage needs. Do you anticipate any major medical procedures? Do you have a chronic condition that requires regular medications and/or specialist visits? Is anyone in your household pregnant or planning on becoming pregnant in the coming year? Do you have follow-up visits planned in the coming year? Will you be getting physical therapy? Do you regularly visit a chiropractor or acupuncturist? Click Continue Plans to move forward. These are general rules regarding metal levels. Depending on the kind of medical care an applicant typically seeks and how often they need it, will play a significant role in the affordability of a plan. For instance, if a specialist is in-network in a silver plan, but out-of-network in a gold plan, it may be that the silver plan, especially if cost-sharing reductions are applied, is the more affordable option. We will go into those details in the coming slides. Individuals under 30 can enroll in a catastrophic plan. However, advanced premium tax credits cannot be applied to this kind of coverage. It helps to understand a few common health insurance terms when shopping for a plan. A premium is the monthly plan payment. You pay this whether you use your coverage or not, and even if you meet your out-of-pocket maximum. A deductible is the full cost paid for services both medical and drug until the deductible is met. Some plans cover services like office visits before the deductible is met. Some plans are tiered. Preferred tiered providers have a lower copay. Non-preferred tiers are higher. Your out-of-pocket limit is the maximum amount you will pay for medical care in 1 year, premiums excluded. A copay is the amount you pay each time you have an office visit or other service. Different provider types have different copays. Annual physicals have no copay. Preferred or non-preferred tiers apply. Coinsurance is a portion of medical care you share with the insurance company after you meet your deductible, but before you meet your out-of-pocket limit. Some prescriptions cost less than others. Preferred, generic, and specialty drugs will have different costs, including copays or coinsurance after the deductible is met. Insurance companies contract with providers to set a price for services. If carriers get a better price, so will you. Providers with the green checkmark are in-network and will cost the least. Providers with a yellow checkmark are non-preferred network providers, Tier 2, and will cost more. Providers with a red exclamation point are out of network and not covered by your plan. As you can see in this example, some of the medications we listed are covered and some aren't. In this case, there are brand name drugs, Neurontin, and the generic version, gabapentin. This illustrates how carriers are more likely to pay for a cheaper drug than a more expensive alternative. Next to each plan name is a View Plan Details button. This allows applicants to do a deeper dive into what is covered and what is not. Here you will find links to the insurance company's provider directories and drug search tools that may be more accurate than the Plan Compare tool. Viewing the plan details gives you more information about the doctors, hospitals, and medications you listed, as well as the cost for labs and imaging, urgent care or emergency room visits, prenatal care and delivery, and hospital stays. By clicking on the Compare box on up to 3 plans, it is possible to do a side-by-side comparison of plan details like premium, deductibles, and out-of-pocket costs. From the Compare Plan screen, applicants can do a side-by-side deep dive into healthcare costs. You can also access plan details from this page. Again, you can learn more about the doctors, hospitals, and medications you listed, as well as the cost for labs and imaging, urgent care or emergency room visits, prenatal care and delivery, and hospital stays. The plan you choose should have premiums and copays that fit your budget, have a manageable deductible based on your anticipated medical needs for 2025, provide in-network coverage for the doctors and hospitals you use most, cover the prescriptions you take regularly, and cover any other practitioners or services you regularly use, such as physical therapy, routine lab work, imaging, etc. It is very important to note that the Plan Compare tool is separate from the CoverME.gov application. When you have made your selection, write down or take a screenshot of the plan you have chosen. Look for your plan when you reach the Select Plan section of your CoverME.gov application. Even if you have marketplace coverage, you may also qualify for other programs that help pay for out-of-pocket costs like deductibles and prescriptions. Consumers for Affordable Healthcare is a resource for consumers whether they are insured or not. If you need help understanding your plan, updating your application, applying for hospital-free care, or transitioning to other coverage, you can call us Monday through Friday, 8:30 a.m. to 4:30 p.m. at 1-800-965-7476. Thank you for watching this presentation on how to use the Plan Compare tool. Consumers for Affordable Healthcare hopes it was helpful, and we look forward to helping you again if you need us in the future.